Hi, Miss Chamick.
Hi, how are you?
Hi, good. Chandler Zalek, student nurse practitioner. Good to see you again.
It's good to see you as well.
How have you been since last time?
I've been good.
Good. So what are you here for
I'm
this visit?
here for a baseline pulmonary examination.
Okay, awesome. And any changes in your history since I last have seen you?
No.
Okay, have your allergies changed? I know we have Prevacid and penicillin on file.
No.
Okay, all right. No new medication
No.
allergies at all?
No.
All right, perfect. Just a few questions before we get started. Any history of respiratory illnesses? Do you have any asthma?
I do.
Okay. Is it exercise-induced or?
It is exercise-induced, but it's also seasonal-induced with allergies.
Sure.
So,
Okay, and how has that been this past season for you?
not a problem.
Okay, good. Any history of pneumonia at all?
When I was younger.
When you were younger. Okay, any bronchitis?
Occasionally, you're here and there.
Okay, all right, kind of just when you get sick.
Mm-hmm.
Sure. Do you smoke at all?
No.
Okay. Any history of lung diseases?
No.
Within yourself? Any history of lung diseases in your family at all?
No.
Okay. All right. So as we get started, I'm just going to ask you to put out your hands so I can see the back of your hands. And I'm going to start by just looking for any bruising or thinning of the skin. That would indicate any long-term steroid use for lung disorders or any signs of smoking. They look good. Great. Now what I'm going to have you next do is the Shamross test. I'm going to have you put your two fingers together like this. Perfect. Just kind of like a half heart. Great. And at this point, I'm just checking for finger clubbing and fingernail angle, and that looks good. Excellent. Now can you put your arms straight out for me? Perfect. First I'm just going to feel the temperature. You can relax those wrists and just put them down for now. All right, great. I'm looking for that. And now can you hold them out for 3 seconds? I'll count. I'm just going to check for tremors. 1, 2, 3. Okay, excellent. Next, I'm going to ask you to bend your wrists back while you go like that. Okay, and at this point, I'm going to be looking for any shaking or trembling. All right, perfect. If I did see any tremors, that could be a sign of CO2 retention, but everything looked good there. Next, I'm just going to check a radial pulse, okay? And as I do that, I'm just going to assess for skin color and tone. At this point, looking for any signs of blueness, which would indicate cyanosis, which would also indicate lack of oxygen or hypoxia. Any current shortness of breath at all?
No.
Okay, good. Good, and also I'm assessing for your respiratory rate and rhythm, and it looks normal, about 18 breaths per minute. Perfect. I'm going to have you turn your head to about 45-degree angle. Great, and at this point I'm just assessing for jugular venous pressure. If it was increased, it could be a sign of cor pulmonale, which is a respiratory issue, but that looks great and feels good. Next, I'm just visualizing you. Your color looks good. Not too pale. You're not blue at all. No mottling of the skin. No yellowing. So that's also good as well. So now we're going to start with the chest assessment. First, I'm going to look at your anterior chest. I'm just inspecting, and at this point, I'm looking for symmetry. Any scarring, any indications of surgery. Have you ever had any respiratory surgery or any chest surgery before?
No respiratory, just I had a breast reduction.
Okay, great. But nothing for the lungs or anything like that? Okay, perfect. So now I'm just going to be assessing your windpipe position. I'm going to place my fingers on your trachea, make sure everything, good. Everything's symmetrical and everything's even. So now what I'm going to do is I'm going to check for chest expansion. So I'm going to put my hands under your breast and I'm going to have you breathe in and out for me 3 times, okay?
Okay.
All right, go ahead. Good. Yep. Perfect. And one more. Great. And at that point, my hands are moving in and out as you breathe in and out. Okay. So now, also what I'm going to do is I'm going to just palpate your chest and feel for any subcutaneous air trapping. No snap, crackling, or pop. That's good. Okay. Perfect. Next, what I'm going to do is I'm going to listen to your anterior chest. As I put my stethoscope on, I'm just going to have you take a couple deep breaths every time I move it, all right?
Okay.
Okay, I'll start up here. Go ahead. Good. Excellent. Perfect. And I moved in a ladder position to assess for symmetry as well in all lung sounds. Any pain at all or uncomfortableness with the breathing in and out? Okay, excellent. One other thing I'm going to do is I'm going to put my hand on the intercostal spaces, and I'm going to have you say 99, and I'm just going to be assessing for respirations, okay? Okay, go ahead.
99. 99.
Okay, I'm going to write it here.
99.
Yep.
99.
Perfect.
99. 99.
Perfect. All right, now this portion I'm going to move to the back of your chest.
Okay.
Okay, and I'm going to move your hair out of the way. I'm going to do the same thing. I'm just going to inspect for any deformities or scarring. Everything is symmetrical. Everything is even. Skin temperature is good. Skin color is good. Okay, I'm going to palpate again just for any tenderness back here at all. No. Okay, can you take a deep breath for me? I'm just going to assess the rise and the fall. Great. And then the same thing, I'm going to put my hands together. I'm going to have you take 3 deep breaths. Good. Another one. Perfect. And one last one. Okay, great. So the same thing, my hands rise and fell as you breathed in and out. The next thing I'm going to do is I'm now going to percuss your lung fields. So percussion means I'm just going to listen for how sound travels, all right?
Okay.
So I'm just going to put my one finger on your back and tap it with my pointer finger of the other finger, okay?
Mm-hmm.
And you just can breathe normally for me. Good. Any pain with this at all?
No.
I'm just going to map the borders of your lungs. Okay, excellent. So now what I'm going to do is I'm going to have you say the same thing, how we did 99 on the front, we're going to do it on the back as well, okay?
Yep.
Go ahead.
99. 99. 99. 99. 99. 99. 99. 99.
Perfect. So now what we're going to do is I'm going to auscultate, which just means listen to your lungs again. I'm going to listen for breath sounds. I'll be listening for abnormal breath sounds, so any crackles, which would be a popping, which could indicate fluid in your lungs, any stridor, any wheezes, or rhonchi, which are rough, harsh sounds that are not normal to be heard. So the front sounded good, so I'm just going to listen to the posterior aspect of your lungs. And same thing, just a deep breath in when you feel my stethoscope.
Okay.
Perfect. Now I'm just going to have you put your arms out in front of you. Great, and I'm going to listen to your lungs under here. Deep breath. Good. Deep breath. All right, perfect. Any discomfort with that at all?
No.
All right, everything sounded good. All lung sounds were audible. I could hear everything perfectly. No diminished sounds. No abnormal crackles or wheezes. So now this next test we're going to do, it's called whispered petriloquy, and I'm going to have you literally whisper 1, 2, 3 as I listen with my stethoscope. So what I'm assessing for during this test is any lung consolidation, which could be a sign of pneumonia,
Okay.
Or any other lung illness or disease, which you have fluid or air in your lungs. So when you feel my stethoscope, just do me a favor and just whisper 1, 2, 3. At the same time, I'll be looking at your lips just for movement. Perfect. I could not hear you say 1, 2, 3 at all, but I could see your lips moving, which I know you're saying it. That is a That is a positive thing because if I could hear you say it, sound travels better through consolidation. So that is all normal there. And then this last test we're going to do is called the Goffney test. I'm also going to be listening with the diaphragm of my stethoscope. And as I place my stethoscope on your back, if you could just say E for me, and I'm going to listen to how the sound travels. Okay? Are you still doing okay? Do you need to take a break? Any shortness of breath?
No.
Okay. All right. Go ahead. E. 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 Perfect. I heard E just the way you were saying it. Sometimes another indication of consolidation would be the transmission of the E sound to an ah or an A sound.
Okay.
So everything looked great on your exam. Do you have any questions for me today?
No, I don't.
No? Okay. I would just recommend following up yearly, just for preventative measures, and certainly following up with me maybe during seasonal allergy season when your asthma is induced, or if you have any trouble with your asthma during exercise-induced activities. Now, do you have an inhaler, or
I do.
you have an inhaler, just a rescue inhaler?
Yes.
Okay, perfect. When's the last time you used it?
A while.
Okay. Is it still up to date? Do you need a new prescription?
Nope, it's up to date.
Okay, all right. Just wanted to check. That's always a good tool to use in case you need it.
Absolutely.
All right, Miss Chandick. Well, it's great to see you again. And then I'll go write up the report, and then our office will call you for another appointment.
All right.
All right. Thank you
Have a
so
good day.
much. You too.